but as some of you know, there was a general strike in Italy yesterday, almost no trains. I mean, trains from Milan or Rome, possible. Trains for smaller place, impossible. And then we have few. My idea about this meeting is to try to somehow more learn from other association, other like our own, the Italian one, learning from the British, which are all almost perfect, then from the Spanish, then from the French, and try possibly to coordinate and to find that there are some actions which we could run together. But, you know, the format of this meeting is basically people giving talks, but the opening is proper to the format of the APIC meeting, the Italian meetings, which is basically to let people involved in the illness, I mean, people who have the illness, or people who take care of people having the illness, who speak about their own experience and put questions. In our meetings, we have even many doctors, and the doctors explain, you know, the experience of the people having cholangiocarcinoma or taking care of one having it. Thank you very much. And now there are presentations by the different associations, starting from the British one. As I said, you know, my aim, at least, in suggesting this meeting and in preparing for it is to an exchange of experiences and possibly in finding some aim we can pursue together, because sometimes we have to act with local agency. I mean, like in Italy we have IFA, then there is the European agency, EMA, and there are specific problems. I've lived very many times with people writing me or meeting me, people with cholangiocarcinoma, and it is the access to the new drugs. And the problem about that is that basically, at least in Italy, it takes about 3 years to have a new drug available for people with the illness, but 3 years for people with cholangiocarcinoma, and I suspect even with other illnesses, are too many.
Buongiorno. Grazie a Paolo per aver organizzato questo evento e per avermi dato questa opportunità di parlare con te. Ora mi dispiace, il resto della mia presentazione sarà in inglese. So back in 2002, at its inception, AMMF was the world's first charity dedicated solely to cholangiocarcinoma. And today, 23 years later, we remain the UK's only cholangiocarcinoma charity, now working nationally across Europe and collaborating globally. But what do those initials AMMF stand for? Well, the charity began as the Alan Mormont Memorial Fund, evolved into AMMF as a working title, and it's now formally AMMF, the Cholangiocarcinoma Charity. And before I talk about AMMF's work, I'm going to set the scene with a very brief overview of cholangiocarcinoma, which I probably don't need to do with this very knowledgeable audience. Next slide, please. Cholangiocarcinoma is also known as bile duct cancer, but it's one of the biliary tract cancers. The others are gallbladder cancer and ampullary cancer. It's important to know that there are 3 anatomical variations of cholangiocarcinoma. Next slide, please. And they are intrahepatic, when it happens in the ducts inside the liver, hilar or perihilar, when it happens at the confluence of the main ducts as they join together, leaving the liver and become the common bile duct, which goes down to join the intestines. And that's believed by many to be the most commonly occurring type, but there's no code in the ICD classifications up to and including ICD-10, and that's been the cause of many difficulties here because it just isn't properly recorded and registered. And then we have extrahepatic or distal cholangiocarcinoma, and that's when it happens anywhere along that common bile duct from the cystic duct down. Back in 2002, AMMF began with 3 aims: to raise the awareness of cholangiocarcinoma, to provide information and support, and to encourage and fund research. And I will talk about these as I go through my presentations this morning. But they have remained our aims from the very beginning. One of the major problems is that we didn't have the robust data to support our requests for better recognition of this challenging cancer, nor for policy improvements. And it seemed that a key barrier to improvements in the cholangiocarcinoma landscape was the lack of robust data to back up the lived experiences we were witnessing: rising incidence, significant variation in diagnosis and treatment, and early diagnosis and survival rates were not improving. In fact, they are considerably worse than for other cancers. You're there. And very worryingly, contrary to existing data at that time, we were seeing more younger people being diagnosed and losing their lives. And all of these young people, tragically, have now been lost to cholangio, some within weeks of these photographs. Next slide, please. So that's why, back in 2018, AMMF commissioned and funded a first-of-its-kind cholangiocarcinoma data project from within Public Health England and later with Health Data Insight in collaboration with our partners at Imperial College London. Data from some 50,000 patients with biliary tract cancers between 2001 and 2018 were used, and these findings confirmed what we knew. Next slide, please. The incidence is increasing year on year. Cholangiocarcinoma is a growing untargeted problem. More younger people are being affected. Over 20% of patients were under 65 years old when they were diagnosed. Survival rate is appalling. Mortality is parallel to incidence. And some very concerning facts were uncovered that we weren't aware of, including over half of cholangiocarcinoma patients received none of the treatments currently available for this cancer. No surgery, no stenting, no chemotherapy. And across England, there was geographical variation in routes to diagnosis and treatment, and also in incidence. Next slide, please, Paola. So this substantial body of work has resulted in 3 papers, all now published. So finally, we at AMMF have the robust published data to support what we've been seeing. Next slide, please. And backed by the findings of our data project, AMMF went on to launch the Rethink Liver Cancer campaign. With the virtually equal levels of incidence of hepatocellular carcinoma and cholangiocarcinoma, as of 2020 in England, hepatocellular carcinoma was 2,792 and cholangiocarcinoma 2,706. We are asking, why is cholangiocarcinoma so under-recognized? And that the time has come to stop thinking of liver cancer as only hepatocellular carcinoma, but to fully recognize cholangiocarcinoma as a primary liver cancer too. So to raise public and professional awareness of cholangiocarcinoma regionally and nationally, and particularly within the planning of health policy, we also produced a white paper, which we launched at AMMF's first Westminster reception, that's our home of the British Parliament, in February 2024. However, it's hard to change long-held perceptions, so there's still a long way to go to improve the future for all those with cholangiocarcinoma. So during 2025, this year, we pushed the Rethink Liver Cancer campaign further with our ask for a fairer deal faster. Next slide, please. And to support our ongoing campaign, we were fortunate that Rankin, the Scottish celebrity photographer, donated his time to photograph an impressive group of people for AMMF, all of whom have one thing in common. They have each been diagnosed with cholangiocarcinoma. We built our campaign this year around these courageous people, some of whom in the UK are quite well recognised, like the journalist and royal correspondent Katie Nicholl and the designer Zandra Rhodes. Each one of their stories illustrates the need for far more recognition and awareness of this cancer at every level from primary care up, and each one illustrates how access to the right specialists and treatment has enabled them, although not cured, to live life to the full after a cholangiocarcinoma diagnosis. And through them, AMMF has achieved more media coverage than we've ever seen before, and we had a few appearances on national breakfast time television, on radio, and absolutely miles of newsprint. Next slide, please. So to achieve a fairer diagnosis, sorry, could you go back one? No. Could you go back one? So I've just missed one. So to achieve a fairer deal faster for all those with cholangio, these are our asks across the UK. We want a widespread adoption of up-to-date guidance on the diagnosis and management of cholangiocarcinoma in all NHS hospitals. We want expanded access across the NHS, that's our National Health Service, to the latest cancer detection technologies, and that includes liquid biopsies. And patients should have fast and equitable access to the specialists in the diagnosis of their treatment of cholangiocarcinoma within our National Health Service, no matter what their background or what part of the UK they're diagnosed. And I'm sure those asks translate across every country in Europe as well. We also want a standardised approach to monitoring for cancer recurrence, because we know that even people who've had good surgery, this cancer can come back. And we want faster and more equitable access to molecular profiling, which is extremely important now that we have targeted therapies. Next slide, please. So, back on the campaign trail, we returned to Westminster in February this year to promote the Fairer Deal Faster ask to those with the power and hopefully the will to make policy change. Next slide, please. And we also went to the Scottish Parliament, Holyrood, to ask for better care and support for those with cholangiocarcinoma in Scotland, where our new Scottish data is showing that pro rata, the incidence there is as high, if not higher, than in England. Next slide, please. So, but the patient is at the heart of everything we do. So, in parallel with our awareness raising and policy work is our second aim, providing information and support to those who need it. And we do it in a number of ways, most importantly with our comprehensive website, which is a one-stop shop for everything to do with cholangiocarcinoma. And for those in Europe, we have a website in 8 different languages, including Italian. But now with the growth of the new advocacy groups across Europe, we hopefully will find the need for our help, although we're always willing to share everything we have, will become less as the European patient has their own groups to turn to. Next slide, please. We're daily users of the social media channels, where we also have private discussion groups, and they're open to people actually across Europe, across the UK, but really across the world. And that's where people can privately discuss their concerns, what's helping them, what's not helping them. They're extremely well used and they offer great support. Next slide, please. And we also have a growing number of resources, all available to download from our website or on request as hard copy. And many of these we have in a number of languages as well. And we're currently supplying them to our growing network of nurses for their cholangio patients, which is especially important for the information on molecular profiling. Next slide, please. Which we do have. Sorry, Paolo, next slide, please. Which we have a brochure and a video. And for those of you who might be familiar with Professor Bridgewater, who's absolutely the lead in UK and across Europe, he appears in the video as a little avatar and he speaks and people love that. So, and next slide, please. Paolo, thank you. And our third aim, to encourage and support research. This is an area where we've seen some amazing changes. Over 20 years ago when we began, there was little or no interest in cholangiocarcinoma, and we had to search for anyone doing anything for cholangiocarcinoma to what is happening today when the number and quality of funding applications coming to us is astounding. And I think to date, for a very small charity, which we are, we have awarded nearly £3 million in research funding. And in fact, the last year alone, we have given out nearly £750,000 in funding across the UK and across Europe as well. So, and as you can imagine, we're delighted to see that interest coming up. But you know, the work goes on. Even though we have worked now for nearly 23 years, we still have such a long way to go. We do have the cold, hard data, that robust data we long needed. But for some reason, the widely held perception of cholangiocarcinoma being a cancer of low incidence continues, and with it, the lack of awareness, which leads to many people not getting the care they should have. So we keep working. We'd ideally love to see specialist MDTs who can really look at each patient and give them the most suitable treatments, the best treatment pathways. We would like to see centres of expertise so that all patients are referred to knowledgeable centres. And until we can be sure that every single patient is receiving the best advice and the best care, our work will go on. Next slide, please. And please save the date. The registration actually is now open, but 13th to 15th of May, we have our European Cholangiocarcinoma Conference. It takes place in Stansted. The venue is right beside Stansted Air and Rail Terminal, so literally 2 minutes walk. So it's easy to come to. We make no registration fee and everybody is welcome. Next slide, please. Grazie.
This is my turn. I have no slides. I'm slideless man. You know, as I said, I wanted this meeting for two main reasons. First, is there something our association can pursue together? Although cholangiocarcinoma is a rare tumor, but not extremely rare, in Italy about 4,000 people die from it each year. So many. Which means it's a small town, but still a town, which disappears in the country just for this illness. The attention to this kind of illness is very limited. The subtle signs of its onset are unknown to the general population, and prevention by those who have been at risk is almost non-existent. In Italy, I don't know how it goes in other countries, but in Italy the situation can be different according to where you live. If you look at our map of where to turn for therapy, you know, there are a lot of places in northern Italy, many, I mean, in Lombardia, you know, the Milan area, quite many even in the Bologna area, the Emilia-Romagna, some very good center in this region, Veneto. And then you move down, there is something, you know, in Rome there is something, in Naples there is something. Now even in Puglia, which is the Bari region, there is something. But southern of that, there is almost nothing, you know. And even just to have to cross from Messina to Palermo, from Catania to Palermo is not simple for having proper therapy. You know, then in Italy, we as an association sponsored the first funding for NGS, for people, for new drugs. And we went to the Camera dei Deputati, which is our parliament, sponsoring it. Basically, what they decided was to put a very small amount of money for 3 years, 200,000 euros each year for 3 years, which covers, at least in the cost they suggested, cover about 160 tests per year. Then this has been subdivided for the regions, because in Italy, our healthcare is regionally based, is not nationally based. So, you know, if you have to find a solution for Lombardia, then you have to find a solution for Veneto, then you have to find a solution for Tuscany. It's terribly complicated. Even protesting is complicated, because you have always to go to different people in different regions, and they have different minds, of course. Yeah. Then, you know, one of my aim was very selfish, and it was, what can I learn from you, from the others, you know? You know, the purpose of an association like ours, I think, is an advocacy role. I mean, when I mean advocacy, I mean advocacy at the political level, like the ones even Helen has stressed a few minutes ago, but even down to the hospital, down to the patient, you know, to try to help. Basically, now I get from 1 to 5 messages a day of people asking for help, you know, meaning, where can I turn for having proper care? And that's interesting, even the history of the messages, but I skip it. All of you know what I see cholangiocarcinoma diagnosis means for those who receive it. A very small number of people survive. It's a very delicate thing right from the start. You can't guarantee either at the time of diagnosis or after a successful operation. After a successful operation, the things will go well. Not even for those who will find it successful at the end. How do we address all this? That is, how do we assist those with cholangiocarcinoma or those who care for the people with cholangiocarcinoma? And you know, basically we have exchanged messages. At the very beginning, we started with a WhatsApp where we had been putting any people writing us if they wanted, you know, so they can exchange information, or even publicly in the on the system, but even picking up someone they were more interested in and then connect directly, personally, I mean, not publicly with these. Then we try to communicate with people. We have a site, as everyone has a site. And through the years, I learned something about the sites. At the very beginning, the site was completely, self-centered. We want to have it this way. But the point is that you have to have a site which people find, and they can turn to find information. And then, the people who technically run our site told me, look, let us do this way. Let us weekly or monthly look at the words around cholangiocarcinoma, which are more searched for through Google and other search engines. And then let us write 3 papers a month concerning those terms, so, going up. In the last 13 months, we published 40 papers, small papers. And then there was a point, 40 papers? How can people really run through them? Then we put up an index of these papers, which basically, in the index are structured on the stages of the illness. The first moment, before having cholangiocarcinoma, can you do something? Like, can you do some prevention? Then when you have it, what to do, where to turn for help. And on. There is even a lexicon at the end of terminology relevant for cholangiocarcinoma, so that people who don't know exactly what the doctors tell them can try to understand and try to figure out what they have. Our website now has about 2,500 visits a month, which is, and basically it comes out in the first page in Google, even if at the end, even thank you to Lorenza and Humanitas, who in the page on cholangiocarcinoma at the end put our name, APIC, there is even APIC, so people know. And since Humanitas is always about the first 2 items on Google for cholangiocarcinoma, this put us up, was very helpful too. We hope other main places will do just the same for us. But even if I get between 1 and 5 messages a day, that means at the end of the year that I can have, let us say 500 messages, but the diagnoses are 5,000. That means that there are 4,500 who do not contact us, which is not terrible, but is a problem because most of these people don't find where to turn for help. And I see this from the messages I get. People tell me, look, my husband or my wife or my father got cholangiocarcinoma 10 months ago, and we went this place to the other place, and now we don't know where to turn for a second or third or fourth help. Yeah? Of course, 10 months, as you know, in cholangiocarcinoma are enough to be out of the game completely. So how is it possible to have better help? Then there are things we hope for people with cholangiocarcinoma, which are some of them fairly difficult to get. We even tried a prevention campaign. Look, if you have some risk factor, if you have some even, feeble symptom of cholangiocarcinoma, take an ecography of the superior abdomen, and which is, the first step to know whether you have a problem or not. If they see that you have a problem, then you will move to a more refined test to know what you have. I think that in 10 months, only 2 people asked for that. So it was a real failure. And the point is, why it was a failure? Just because people don't know. because what we wanted was just a Xerox of the recipe of the local doctor and of the bill they paid for. And we will send a contribution for that. Nowadays, we are thinking to go differently and to go to do this campaign not on people, but on general practitioners. Because basically, anyone who has even a small problem try to get in touch with his own general practitioner. This is too difficult. I've tried to get in touch with general practitioners in Italy, and I don't see that I completely failed, but almost. I was able to send messages to about 600 general practitioners. They are about 50,000, 60,000, I don't know. No, but I could reach 500 people. And even I convinced one of the main group of these general practitioners that they have to be more respectful for patient association. So they decide that they will give a small space to 3 associations a year in their own meetings, you know. But, you know, and for the first time even at a meeting of surgeons in Rome, surgeons who are connected with pancreas, with liver, they open with a debate with 5 associations, our own, the Pancreas Association, and that was interesting because they were listening. You know? Basically, one thing that doctors can do, look, if you have this problem, you can get in touch with the association which is relevant for this kind of illness. And this was done. But then, as has already been stressed, you know, there is the problem of having access to the therapy in a proper way. I told you about NGS in Italy, and still it's not clear. Even legally, I get a little mad at the problem. Legally, you know, a new drug is allowed by the Italian Agency for Drugs, AIFA. If there is a target therapy drug, basically you need a molecular profile, an NGS or something like that, you know. But basically the AIFA doesn't cover the expense for that. So they allow the drug, but they don't allow the test for having the drug. And this is irrational, as you can immediately see, you know. And the problem is how to change this. Because I've been once at a meeting with the AIFA, and they tell, look, it's not our role. You know, okay, but someone has this role, and thinks, even if one doesn't have the role, has to think about it and to try to find a solution if possible. And basically, when we went to Rome for this NGS partnership in 2022, there was just only one drug. And then now there are, I don't know, 7, 8 drugs. Some one are covered by the system, some others are not yet covered by the system. And even this is a problem. And it is a problem that, you know, in Italy we take 3 years to approve a new drug, but 3 years, as I just already said, are too many for people with cholangiocarcinoma. Most people, 3 years after, are not there anymore. So these things have to be understood. One thing I learned just a few weeks ago is that in France, they have a nice system called ATU, which basically offers the drug immediately before having this finish the process of how it will cost to the national system, and then there is a reimbursement. And this would be nice even to have even in other countries, because that will offer immediately the drug to the people, and then the economical problem will be solved differently, and there will be anyway the dealing with about the cost of the drug, you know. So this is another thing. I think this is another thing which would be nice to try to have, not just in Italy, but I think in other countries too, because maybe that, you know, the Spaniards are better than Italians, that the British are better than the Italians, that the French are better than the Italians, but I suspect that you have similar problems anyway, you know. We have even another project. In Italy, a surgeon who used to work in Milan and now works in Varese, Professor Balzano, did a very nice job on pancreas and the operation on pancreas. He is a pancreatic surgeon. Basically, he started in 2006, and how does they go when they do surgery on a guy with pancreas in the different hospitals? And at the end, last year, not, which means 18 years later, Lombardia, the region where this guy works, obliged any kind of people diagnosed with pancreas tumor to have surgery only in 14 places in the region, the best places. And they keep statistic on how many people survive 30 days after the operation, how many after 19 days after the operation, how many people 1 year and 5 years later, you know? And this has been very helpful to understand where to bring people with pancreatic tumor. The same thing I would like to do for cholangiocarcinoma in Italy. No? I have get in touch with a lady at the Ministero della Sanità, you know, just to try to have the same kind of work. And I will start, because we have regions, I will start from Tuscany. I have contacted doctors in Tuscany for doing just the same kind of thing. This is a problem, at least in Italy. I don't know whether it's a problem in other countries, because small hospitals don't like this kind of moves. Because small hospitals, these are put aside from this kind of moves. So this is another problem I cannot solve. Basically, this is what we do, what we plan to do. We would like to do even more. Basically, what we do to get in touch with people, apart from internet, is we arrange meetings. And we arrange meetings in different parts of Italy. In the our next meeting would be in Verona, in this part. We had a meeting in Rome, a meeting in Novara, a meeting in Bologna. And we had even small meetings in places like, you know, San Giovanni Rotondo. You may not know San Pio, you know, but San Giovanni Rotondo there is a famous sanctuary with a very recent saint, a guy who died, I think, 30, 40 years ago. And there's plenty of pilgrims, and they have a huge hospital. And small meetings, I want to have a meeting in Rome, and Second University of Rome, to have a meeting in close to Bari, you know, just to be known. Because if we are known, we can help. If we are not known, we cannot help. Thank you very much. One thing I didn't say is that we have durvalumab, you know, which was, at least in Italy, a kind of miracle, was offered to the hospital for, I think, about 18 months with no compensation for that. You know, then at the end, the IFA said, okay.
So first of all, many thanks for the invitation. Thanks, Paolo, for organizing such a meeting. That I hope that we will get some great outcomes on that, and as well for future collaborations. So ATUVIVI is the acronym of Asociación Tumores de Vías Biliares in Spain and Spanish. So it means basically Bile Tract Cancer Association. So here we have our mission and our vision. Apologize that some of the slides will be in Spanish. So our mission is to help to improve the quality of life of patients and also to support the caregivers, because it's an important pillar, as discussed in the beginning with testimonial from the patient advocacy, and also bring more knowledge about this disease and as well the research side. And the vision is to be the leading organization in Spain about supporting patients and caregivers with bile tract cancers, and also advocating with health professionals, researchers, and the administration, the public administration. Next slide, please. So we have three pillars at Atuvivi. The first one is to give an integral support to patients and caregivers. And for that, we have delivered already some of the materials to support them. Basically, we have a decalogue. So when patients or caregivers reach to our website, we have like the 10th things to know about the disease. So one of them, for instance, the molecular testing, how important it is, and also other important knowledge that they need to have, right? Then we have frequent questions to ask to your doctor, so they can print it out and then go to the doctor with this dossier and ask to those questions, that some of the questions they might already know, but some of them might be needed as well. Then we, since the beginning, we have this WhatsApp community, and it helps like patients, caregivers, they are lost, right, on the journey. So some of them, they are not willing to enter, but some of them, they are really willing to enter and to share more their experience. So it helps as well to not feel alone, and to feel like someone else is in the same situation as them, and to get understanding from other people. Also, they are not only talking about the disease, sometimes they talk about their trips, but it's a really active community that every day they say good morning and good night. So it's really nice. Then we have once per month the Atuvivi coffee. So basically, we have a psychiatrist that she's leading this Zoom meeting, and patients and caregivers can join the call. And basically, it's like 1 hour and a half. It's like if they want to join later, never mind. And if they want to leave, it's okay. But it's also more about being able to talk and to put face to each other. I have to say that on the WhatsApp community it's nice, because some of them, they even get to know each other when they are on the hospital, because we try to extend all our network around Spain. So we don't have any broader, any wall in any state. So some people, for instance, in Barcelona, when they are in the hospital before getting the treatment, they meet each other, which is also nice. And then we have the webinar seasons that we try to do once per quarter. On the other side, the second pillar for Atuvivi is to raise awareness about the disease, because it's one of the main barriers that we face, that people they don't know about this disease. And also, not only on the society, as well on the health system. So we are really pushing that through campaigns, and then to push the research. Next slide, please. So I would like to share with you the story of Atuvivi, which I feel that is really nice. Everything started in 2022 when some oncologists and also hepatologists were in a meeting, and they brought up that it was needed an association in Spain of bile tract cancer. So it took 1 year, but during that year they thought how to set up this association. And basically, 19th of October, they gathered some patients and caregivers in Madrid. Some of them there were in person, some other people were connecting online, and they share why it was needed an association to the patients. So patients afterwards, they got in contact, and they started to put this idea into practice. So February 2024, during the Cholangiocarcinoma Awareness Month, we launched the association in Madrid. So we have already 1 year, almost 2 years, next February 2026. In 13th of September, we did a great event in Barcelona during ESMO, which AMMF Helen was there, also Cholangiocarcinoma Foundation, and it was a great milestone, but because we started to partner with pharma industry, and we started to get in touch with as well with newspapers and other media around Spain. 27th of February, you can see this picture, how many people we managed to gather in our first anniversary from Atuvivi in Madrid, which some people already left. It was more than 170 people that we managed to have in place. So it was really, really nice. Also, we had a streaming event, and it helped us to bring up this community again and to raise awareness about the disease. And this is not November, sorry, it was on September, 25th of September. We did the first symposium that is called Convivir. I will talk about that later on, but what Atuvivi got that idea to have, to make collaboration with other digestive tumors associations. So it is more holistic and integrative. And the symposium was about nutrition, about sport, and emotional, psychological, emotional support. But I'll get into that later. So one of the key pillars of Atuvivi is the team. On the group picture, this is the board team that we have at Atuvivi. Unfortunately, the person who is with the red hair, he passed away on May, but the others, so we are all of us, we are caregivers or patients. And actually, I feel that this is the motto of the association. And also, we managed to have some volunteers that they are working with us daily. So we have Marta that she takes care of all the communications, Sheila that supports with projects on the association. Susanna, she also takes care about the communication. And then Rosa, she takes care about the lighting up campaign, the light up green campaign that we are working this February. And also the board members, every one of us, we have different functions. So I think that to have a structure, it's really important to be able to progress. Next slide, please. And also one of the key pillars is to have a medical and scientific board, which Atuvivi has, or at least ourselves, we feel that is something really, really important. We have oncologists, surgeons, pathologists, researchers, psychiatrists, and nurses. So some of them were the ones who launched the project, and they are always next to us in any case if we need some support or some some guidance on the track. Next slide. So one of the key activities that we are doing is to have relationship with the doctors, the oncologists, because they are the ones who treat the patients. So basically, if they know us, they can refer patients to us, and we can help the oncologists from one side, because we take out work to them, the workload, and then also we can help the patient journey to the patients and caregivers. So basically, what we really work is to send brochures to different hospitals across Spain, physically, and basically when patient or caregiver is diagnosed, the oncologist gives the brochure, and maybe the same day they don't contact us, but maybe after 2 days or another day they get in touch with us. So that's really nice, because we try to avoid that patient or caregiver to enter on Google or ChatGPT nowadays to look for the information and see all the statistics, because we don't want to burden them more we want to give hope instead of frustration, which I think that this is important to change this message. Not everything is negative. We also have a lot of people working in that field. We have Lorenza that is on a Saturday here today working as well. So I think that it's something that we have to bring to raise up, that there are a lot of researchers, oncologists working on this area, on this disease area. Next slide. So another way to contact and to raise awareness is social media. As I said, we launched the association last year, and we have LinkedIn, which we have around 365 followers. Then on Instagram, 1,000 followers, as well X, that we have around 300 something as well, and YouTube. So these channels nowadays are key because people can see what we do, also testimonials of people that has been living with the disease for 8 years, 10 years. So this also, again, gives hope that not everything is black. We have also light on the route. And also YouTube, for instance, to share some webinars. So of course, every channel is used for different information, but as I said, all of us, we are volunteers, so we could manage better, but we are doing the best as we can as well on social media. Next slide, please. Well, here I have all the activities that we've been doing this 2025. Basically, we launched the Atuvivis website, and then we started some collaborations within Spain with other the Oncologist Medical Association, TTD group, that are the digestive tumors oncologist group, SEO, that is about nurse oncology. Then also we have sent 6 support letters in research. We've been really active in different conferences, national and international. Then we have had some events. We had already some conversations as well with the health ministry in Spain, and as well with some local communities. Then this year we light up more than 150 buildings across Spain with green. So this also helped us to raise awareness, because we were sending as well a press release to each city. Then also some run events and fundraising activities, the webinars, the Atuvivis Coffee, as already mentioned, the Symposium of Convivir. We have already been included in different talks or in different roundtables in Spain. So researchers have invited Atuvivi to be there, so that was really nice. We have started to have this figure inside of Atuvivi that is the patient expert. So basically to help this patient to have the knowledge to evaluate some projects. So we have 2 people that we are training them to be able to support on this part. We have that Lorenza has the lottery of Atuvivi for Christmas, so it's a nice way to fundraise money as well. And with other associations that they also work in the metastatic, well, they are metastatic oncology. So we collaborate together. 2 of them are from breast, another one from pancreatic, bile tract cancer, and sarcoma. So we join forces that on February we will launch a project together 4th of February. So we also join collaboration. Next slide, please. And this is Convivir. So Convivir, it came up because so I am here because I lost my mom 5 years ago with this disease. And I remember when she had cancer, I was trying to fight against cancer. And right now, when I rethink about that, I don't think that patient or caregiver have to fight against cancer. I think that oncologist researchers are fighting against that cancer, but when you are on that situation, you have to learn to live with this new reality. So convivir, it's like co-living with that new reality. And it was like to gather patients and caregivers with digestive tumors. So we had pancreatic, peritoneum, gastric, and bowel tract cancers that were attending there, and we collaborated with those 4 associations, and we are aiming to launch the Convivir 2026 on next September. So the feedback that we received from all of them, it was really positive. So basically what they thought is like, for instance, we have some keywords about hope, progress, another one, hope, building, cooperation, really a reachable team. So all that, it were keywords that was shared during the conference. And yeah, so we hope to go for the next for the next edition. Next slide, please. Well, this is a wrap-up of 2025. So all the lighting up that we had, also being on media, that it's really important to be present on the media, because of this way we can raise awareness about the disease. Then the events that we had, and also that I was surprised either AMMF or APIC talk about that, but we had a comment on the Lancet that was published on February 2025 about understanding cholangiocarcinoma perspectives from the 3 European advocacy groups. And I have to say there are some caregivers or patients that have found us through that paper, through that comment, and it was with the support of the BTC network. So also it is a nice activity that we have done this year. And next slide. Well, this is a little bit of the activities that we plan to do for 2026. Basically, it's webinars, some events during February, that is the Cholangiocarcinoma Awareness Month. Next slide. Also, some conferences that we'll be attending, and as well the Convivir edition 2026. And next slide. So our keyword is hope. Is confia, that means hope. And basically it's because, as I said before, we don't want to put everything in the negative side. We also want to share that there is people working there, that there are a lot of hope behind the sense, yeah. And next slide. So this is if you want to contact us. Next slide, please. And thank you. It was this year that we lighted up Spain a little bit. So we hope that 2026 edition will be like that. Thank you so much.
In the meantime, we Italian too have webinars available about what we do, and the most successful webinars we have run are psychological, which are kind of social psychological support, and we even offer at a reduced rate individual psychological support, but this is reserved to people who are associated with us. Then we have interviews to doctors, and I like this gallery of interviews to doctors because it allows people to know the doctor before meeting him, before meeting her. And then even to choose the physician who you think you can find yourself better with.
So, good morning, everybody. Thank you, Paolo, again for the invitation. So my slides are going to be in English and in Italian, thanks to internet. I'm not sure if it's well translated, but it looked very nice and cool, so I think it will. So I'm going to present you Espoir Vabilia, which is We are the French Patient Association for Biliary Tract Cancers, and so it means, espoir means hope. So hope, biliary tract. Next slide, please. So I'm not gonna give you an overview on cholangiocarcinoma. I think the situation in France is the same as everywhere else in Europe, with increase in incidence and mortality, and also especially in young populations. Next slide, please. So yeah, this similarly was just to show you an increase in the annual rate of disease for intrahepatic cholangiocarcinoma that is increasing. So I'm going to give you just a little overview on how the patient association emerged in France. So it directly emerged thanks to this association, which is called ACABI, which is not a patient association, but an association for clinicians and researchers for the study of biliary tract cancers and pathologies. So it has been founded in 2018 by Cindy Neusillier, that you can see here, and now the new president is Gaël Roth on the right. And so the idea of this association was to support multi-centered collaborations in France between professionals for both clinical project and translational or more fundamental research project. And as you can see here, it's working well. There is a network of professionals everywhere in France. They are collaborating together, and this gives rise to many publications, clinical trials, and so on. And so another thing that they did is that they established a comprehensive picture of cholangiocarcinoma management in France to then find what are the weaknesses in the journey of patients and what can be improved to improve diagnosis and the care of patients. Next slide, please. So this is what they did. So they reached out to many oncologists everywhere in France, and they asked them several questions on what's the reality in your region, in your center, in your work, on like the care of cholangiocarcinoma. Next slide, please. And so this has been sent to a pathologist, gastroenterologist, but also surgeon, oncologist everywhere in France, and both in private clinics and also in the bigger university research hospital. And also we have centers in France that are dedicated to cancer, and so to there too. Next slide, please. And so this one is in French, but this is just to give you an overview of what they found. So this is a typical journey for the care of cholangiocarcinoma for patients, and you can see that they stressed in yellow and red several points that could be improved, and they overall divided that into 3 different thematics. So the first one is the access to diagnostic and to the right techniques and expertise to improve, like to get a correct diagnosis. The second thematic is the access to molecular profiling. As Paolo was saying, this is really key for the treatment strategies for the patients. And the third thematic is just the spread of the knowledge on the disease in France for both the professionals, so they also know all the new therapeutic innovations that are emerging, and also directly for the patients, so they have a better access to information, which directly improve their quality of life. Next slide, please. So for the thematic one, this is about the access to the diagnosis. So we all know that one of the main issues of cholangiocarcinoma is that the diagnosis is often made too late. So it has different reasons. One of them is, of course, because the symptoms are often late, and the disease will grow for a long time before the first symptoms would appear. And one of the other reasons is that there is in France, poor coordination between the primary care and the specialized structures. That means when you start to have the first symptoms and you go to your general physicians, and then the time you actually be diagnosed with cholangiocarcinoma, it's too long. It takes too much time, and so this is time where the disease is growing. And this is in part due of the fact that in France, it's very decentralized. So you would go get your care to the center that is the closest to you, but often these centers don't have the right expertise, the right technologies to actually diagnose you. And the time they will send you to the right center, it takes time. So these techniques for diagnosis are often found only in the big centers, and this increases the inequalities based on the locations where you live. So the solutions proposed was to improve the training of the generalist physicians and the specialists, and to create a directory of expertise and techniques. So these centers can provide this expertise and these techniques by regions to then help orientate the patients earlier in their journey. And also to improve the share of the medical information between the physicians. So if a patient is sent to another bigger center, they can, in this center, have access to the information of the patients from before. And also to establish standardized protocols for imaging and biopsies everywhere in France to decrease the level of inequalities across the territory. Next slide, please. So the second thematic was the access to genetic testing, because this directly addressed the treatment possibilities. So recently, thanks to this work, now the cholangiocarcinoma cases are discussed with multidisciplinary doctors, physicians. So you have oncologists, but you also have people that know very well genetics, surgeon, everything. So the cases are more discussed, and this also improves the orientation of the patients to the best treatment strategy. But one key thing is the genetic profiling, and this has a cost, of course, and it was very not common for cholangiocarcinoma patients for a long time. But we know now that with the emerging of targeted therapies, all the patients should have a genetic test. So the solutions proposed were to improve the remuneration of the specialists to encourage review more cases through an increase also of the virtual meetings. So everywhere you are in France, if you have an expertise, you can discuss patients' cases from the other side of France. And to standardize the genetic testing protocols and improve the access to sequencing platforms. And because it has a cost, maybe try to include more patients in clinical trials, because this is a way to cover some of the genetic testing fees. Next slide, please. And so the third thematic, the one from which we will directly emerge, is that there is a major lack of diffusion of knowledge and therapeutic innovations in France, which limits the access to information to both the professionals and the patients. And so the solutions proposed were to organize more meetings and trainings for professionals, and to raise awareness to inform the public, create an online clinical trial tracker for the professionals. And one main thing was to help the development of a patient association. And so this is how, based on this work, Cindy Neuzy and Akabi started to think about how they can develop a patient association for the management of cholangiocarcinoma and overall biliary tract cancers in France. And so this is how directly Espoir Voie Biliaire emerged. Next slide. And so this has been done in collaboration with the Espoir Pancreas. So the idea was because these are diseases that can share similarities. Of course, they are very different. But if we could directly benefit from Espoir Pancreas that was created 10 years ago, so we can also benefit from their network, because many of the physicians would see both pancreatic and biliary tract cancers. And so their experience in events organization and so on. Next slide, please. So this is how Espoir Voie Biliaire was created. So in direct collaboration with Espoir Pancreas in February 2025. So we are still young. It's less than 1 year old. And yeah, like I said, the idea was to directly benefit from the experience and network of Espoir Pancreas that was created 10 years ago. And because also the community of biliary tract cancers in France is way smaller than pancreas, so it's we can use also a bit of Espoir Pancreas resources to grow. And there was a synergy in February 2025, and because at the same time on my own, before I knew about this, I was also starting to create a small community around cholangiocarcinoma in France. So I started a couple of months before just like a Instagram and a Facebook page to start initiate something. And then when I heard about Espoir Voie Biliaire, I just decided it's better if we all unite together. And so I decided to join them in this. And at the same time also, a couple of years before, there was the creation of the Fonds Clémentine Vergniaud. So this is the main role is to only raise money. And this has been done. Clémentine Vergniaud was a journalist in France that passed very young because of cholangiocarcinoma. And so her family, that you can see on the picture, the three person on her two parents on the left and her husband in the middle. She was very famous because she did a podcast along her journey on everything she was feeling about the disease until she passed away. And there is a book now also about like her journey. And so all the money that they get from this book are directly going to the fund to help improve cholangiocarcinoma management in France. And so they are also part of Espoir Voie Biliaire now. And so basically, this is how we are Espoir Voie Biliaire. So Philippe François Steninger is the president of both the Pancreatic Association and the Biliary Tract Association. Marine Mercier, a patient, Grégoire, who is the husband of Clémentine. Alexandre Rotureau is also a young dad that lost his wife. And Camille was a patient who passed away a couple of weeks ago. And so the three different associations, the ACABI for clinicians and researchers, Espoir Voie Biliaire, and the Fonds Clémentine Vergniaud to raise money, we really unite together and we share the same website. So it's a website where each of us will have a subcategory for us, but we try to unite together like this. And so the objectives of the patient association Espoir Voie Biliaire is to raise awareness and inform on the disease both to the publics and professionals. So we already created a website and social media. We try to establish a network of clinicians and patients all around France, but also in the French-speaking parts of Switzerland and Belgium and Luxembourg. So we are in touch with physicians and patients there. We try to plan some events in collaboration with Espoir Pancreas. And we are very active in the national and international networking. So in touch with, of course, the Italian association, AMMF, A2VB, but also now with the Croatian association and Turkish associations, where we try to stimulate some things there as well, because there is a need as well there. And we are in touch with some pharma companies, of course. And for sure, it's very much easier for us now because of all the work that has been built by AMMF since 23 years, by A2VB, by APIC. We came here and like a lot of the work is already done. So this is very inspiring, all of that for us. And support directly the patients, families, and relatives. So we will plan events that are directly dedicated to the patients and caregivers, like the coffee things that you did. All of that is, I think, it's very good ideas for us too. And alert on the necessity to improve the diagnosis and care. So improving the patient's journey overall everywhere in France, especially at diagnosis. And we also are directly involved in a research project that we try to support. So clinical trials we support through supporting letters most of the time. It can be also some physicians that would come and ask us, like, what would be the best? When should we do like genetic testing? How can we give the information if it's negative to the patients as well? What's the best way? Type of things. Also, we do fundraising to directly finance PhD project. So we try to finance one every 2 years. So one has been financed this year, and we will try to finance another one in 2 years. We are now partner of the Ladies Circle Club. So this is a network of associations of women in France, and during 2 years they do events to raise money that they give to one association, and they have to pick which association. And so this year it was us. So this can represent several 100,000 euros in 2 years. So that's going to be a massive income for us. And yeah, I think that was the last slide. So thank you very much. We are still a young association, so it's very inspiring to see all the works done by the other association.